You know how the brain and the heart are always in conversation? So if your brain is playing up, most likely your heart is going to get affected too, and vice versa. So interestingly, we had a 67-year-old lady very recently who came in with 2 days of acute confusion and slurring of speech, and she was found to have a left embolic stroke. So, as a part of her stroke workup, she got a carotid ultrasound scan done, which showed severe stenosis of her left internal carotid artery with severe atherosclerotic plaques. So she was for a carotid endarterectomy because she was very young and pretty functional before she came into hospital. And also, this stroke didn't actually leave much deficits for her, like she was mobilizing without any concern, but only there were issues with her speech, which could obviously improve with speech therapy. So, as a part of her workup, she also got an echo done, and the cardiologist who did the echo calls us and say, this patient has regional wall motion abnormalities. Does she have any chest pain? And we're like, no, she never had chest pain. So interesting. So she get serial ECGs done after the echo. So her admission ECG, which was completely normal, is now showing T-wave inversions. So the question was, is she having a silent MI? And she get serial troponins done as well, but they were static, like 66 and 66, and then downtrending. The third one was 16. But then the vascular surgical team said, no, we cannot operate on her until we get clearance from cardiology for general anesthesia. So she gets a CT coronary angiogram to exclude coronary artery disease, and that comes out clear and normal. So she goes on a beta blocker and an ACE inhibitor for a week, and then she got a repeat echo in a week, which was completely normal. So the thought was the stress cardiomyopathy or Takotsubo was secondary to the stroke she had. So yeah, so she was fine for general anesthesia, and the vascular surgical team was happy to operate on her. So it's very interesting. So if your brain is affected, most likely your heart will do.